Christian for taking the time to help us, the Splatsin Health Services MOU Health Transformation Team, to kickstart this project. As you just heard, we are following the original version outlined in the Splatsin Healing Strategy drafted in 2009. And as the project lead, my responsibility since initiating this project in 2019 was to take this from idea to action. This means ensuring there was, and continues to be, a sound timeline, method, plan, and design. And speaking of timeline, COVID-19 pandemic was declared within days of our final stage of phase 1 of this project, which was collecting, analyzing, and reporting all community data gathered through 7 months of community engagement sessions, health service delivery surveys, and mailouts. Our final deliverable last year was to present all of our findings to Chief and Council on March 3rd, 2020. And as you know, we hit the pause button in order to put all our efforts here at the Health Center to respond to the COVID-19 pandemic that was declared on March 12th. So let's take a step back and share with you in more detail what we accomplished in those early months of this project. I will turn this over to Crystal and then Marla as part of our MOU Health Transformation Team to discuss more detail, and then I will close with some next steps.
Greetings. My name is Crystal Morris, and the role I played in this Memorandum of Understanding transformation is I was the community engagement coordinator. So throughout the months of June and July of 2019, we conducted 8 face-to-face sessions. And what was presented was current programs here at the Splatsin Health Center that we received funding for, in addition to presenting information on the programs that Splatsin Health delivers that are not currently funded under our agreement. And in addition to that, we also provided information on other models from other First Nation and Indigenous communities. In those sessions, we gathered feedback through discussion on Splatsin Health Services and recorded the data on chart paper. We also used computers at the health center to gather information on that same survey, and we delivered those door to door, and we also distributed them by mail and took those door to door in addition to email sent out to all the people that have provided the band with their emails. And as well, we just want to say thank you to everyone for the face-to-face participation and the many responses we've received to the survey. Thank you. Coach Jan.
I'm Marla Turner, and my role with the project was to take all the data that Crystal had gathered and compile it together, analyze it, and look for themes and patterns and kind of lay out a path forward. So that's what I'm going to talk about here, what we found. So the project team is very grateful for the generosity of the knowledge shared. We thank you for providing the foundation for this project. I will quickly cover the main points of what we heard. A reminder that all feedback gathered was anonymous. Names and identifying factors were not recorded with any of the data. Your feedback identified the service gaps, the community's main concerns, and needs. From these findings, a theory on a new health service delivery model was developed. Community has highlighted 3 areas of priority for Splatsin Community Health Services. The first priority is connection. Participants desire to connect with health staff who are culturally oriented to the Splatsin community by the Splatsin community. Staff are required to practice from a relational perspective and be available to provide outreach and advocacy. The second priority is empowerment. Participants desire empowerment to guide, engage, support, and resource individual, community, and cultural strengths to improve community health outcomes. And the third priority is balance. Balance will be maintained by communicating education, mentorship between the staff and the community, staff contributions of clinical services, advocacy, access to health and safety information require the balance with communities' cultural and traditional knowledge, social events, and non-clinical aspects of health. And lastly, for balance, resources are also required to balance the needs in the community. For example, instead of less medical patient transportation available, addictions, counseling, and home care, there needs to be more.
So, as you've just heard, a lot of community information was collected through the engagement sessions and then analyzed and reported to Chief and Council. But because of COVID, we were unable to share this information with you. And that is our goal in these next 2 months, is to share the incredible contributions from you, the Splatsin community. So please stay tuned for information in early January 2021, when we will outline opportunities to connect via Zoom, emails, and mailouts about the community data and the next steps that we will take towards health services transformation at Splatsin Health. Thank you, and continue to stay safe and take good care over the Christmas holidays.